Welcome to Health Vision. I'm Jackie Wolf, Associate Professor of Social Medicine at Ohio University. Today I'm talking to Dr. Electra Paskett of the Ohio State University Center for Population Health and Disparities about cervical cancer. Electra, it's so nice to have you here today.
Thank you. Nice to be here.
We're going to talk about cervical cancer, but before we do, let's talk about the cervix.
Okay.
Because I think even women probably don't know what the cervix looks like. Many women probably don't even know where it is, what it does. So let's talk about, first of all, where is the cervix?
Okay. So let's make one thing perfectly clear to start with. Cervix is only in women. You might think that that's funny, but I've done studies where women think they have prostates and men think that they have cervix.
And you know, that's one reason I'm asking you this, because I know enough from my own research that many women really don't know much about their bodies, and men know even less about women's bodies.
Yes,
so
you're
that's
correct.
That's why I'm asking a very basic question.
You're correct.
What is the cervix?
Okay, so in women, the cervix is found at the end of the vagina. So, and it's at the bottom of the womb.
It's not something you can see. It's way up
It's
in the
way
vagina.
up in. And so if the womb sits like this, then the cervix is at the bottom
And by the womb,
part.
we're talking about the uterus.
The uterus or the womb,
Mhm.
right. And so it's the opening of the womb out the vagina. The menstrual flow would come out, down the womb, the cervix, and out the vagina.
And when a baby is born, basically it's the cervix that opens
The
up.
cervix opens up. That's when we're talking about dilating and
First stage labor pains is
opening,
basically
right?
the cervix
opening up, that bottom part opening up to let the baby's head out. So, it opens 10 centimeters to let the baby's head out.
Describe what the cervix looks like.
What does it look like?
I mean, it looks very different, I would think, when it's closed, obviously. Than
Right. When it's closed, it would look, tight like that, with just barely a little room, here. So then when it opens for a baby, but only during labor would it open. But it's,
But there is a
really
small
close.
opening because menstrual blood.
Small opening for menstrual fluid and sometimes secretions to flow out.
Right. Menstrual blood goes through the cervix into the vagina. So the cervix is an important organ.
That's right.
How do we detect cervical cancer? Women go for Pap smears.
That's right.
Explain what a Pap smear is.
Okay. So a lot of times women know that they're supposed to go for a Pap smear, but they get that confused sometimes with a pelvic exam. So with a Pap smear, the woman goes to her healthcare provider's office, lies on a table, on her back, and her feet are put in stirrups. So, and her legs are spread apart, and then the physician or healthcare provider then gently will touch the labia and open it up and insert a speculum
into the
vagina, which opens it up, and then the healthcare provider is able to visualize, to actually see the cervix up, the end of the vagina, and then the physician then will perform the Pap test, at which time they'll take either what's called a cyto brush, which is it's a device that's on a stick or a wand with a brush on the end. And if we say this is the opening of the cervix, take that cyto brush and gently rub around the opening of the cervix to gather some cells on the brush. And then the brush is taken out of the vagina, and then there is a slide that's there, and the physician then brushes some of those cells on the slide, and then there's a fixant that is sprayed, and it fixes the slide, and then there's that's sealed up and sent off to the laboratory. That's been the traditional Pap smear.
And then someone in the laboratory looks at the slide.
Right. So let me get to that in just a second, because I want to explain the new liquid-based Pap test. So the same thing's done. The speculum's inserted, and the physician inserts a brush or like a pipette and does the same thing, scrapes around to get some cells. And instead of spreading it on the microscope slide, the physician drops that brush into a jar that contains a special liquid. And then that specimen that they've taken, they swish it around in that liquid, so all the cells are in that liquid. And then that liquid jar gets sent off to the lab. And so then at the lab, what happens is the bottle is shaken up by a machine, and then a slide is put into the liquid and come out, and a very nice spread of the liquid with a nice spread of cells is on that slide. And so whichever way the Pap is taken, we have now these slides. So the slides are in the laboratory, and a cytotechnician, very specially trained person who can look at cells, puts the slide under a microscope. And what they're trying to look for is the presence of funny looking cells. So you have normal looking cells which are nice and round and smooth, and what they're looking for are cells that don't look like that. We call atypical. And the number of atypical cells, or how funny looking they are, determines if there's a problem, if the Pap smear is abnormal or normal. So I want to get back for just a second to the difference in the two types of collections for Pap tests. The traditional way, where the cytobrush is spread across the slide, if you are collecting a bunch of cells like this with a cytobrush, and then you go and you spread them, you might not get all of the cells spread on that little bit of a microscope slide. There could be some blood in the specimen, which will get on the slide. And so the traditional Pap test has some false results because of those two limitations. Now, when you do the liquid, all of the cells on your collection device go into that jar of liquid. If there's any blood cells, the liquid gets rid of the blood cells. So then that liquid's shaken up at the lab, and the slide goes in, and it comes out with a very nice smooth array of cells.
So you get a lot fewer false positives?
A lot fewer false negatives and false positives.
I see.
And it's a lot easier for the technicians to read because it's a nice, even, smooth spreading of the cells.
How long has this type of test been available?
Oh, I would say maybe 8 years. I could be a little off on that.
So we know for sure it's much more accurate.
Yes, it's much more accurate. There's a lower recall rate because if on the conventional way, if there's blood on the slide, the cytotechnologist can't read it. So the woman has to come back.
Why would there be blood on the slide?
If there's any bleeding from menstrual period, women should not have a Pap test while they're menstruating.
And women usually know that.
Happens.
The doctor tells them, don't come in.
Right,
if you.
But sometimes you have to schedule your Pap test a year ahead for some doctors who are really busy, and women's menstrual cycles don't run on the same schedule all the time, so there could be some problems. Or any other reason a little blood would get on there. But what we've been able to do with the liquid-based cytology is reduce the number of women who have to come back for a repeat Pap smear because there was blood in the smear, or that the cytobrush, the part of the brush that got to swipe on the slide, just didn't have enough cells. Insufficient cells, insufficient specimen. Those reasons are decreasing because of this new liquid-based technology.